Good day everyone and welcome to News in English with Tutor Tom for the 27th of September 2023. So it is Wednesday, also known as Hump Day, which is the day right in the middle of the week that nobody really likes. So I have got a controversial article to go through today to spice things up. It's all about drugs and the title is UK's first drug consumption room to get go-ahead. The UK's first official consumption room for illegal drugs, including heroin and cocaine, is expected to be approved by authorities in Glasgow later. The facility is backed by the Scottish Government as a way to tackle the country's drugs deaths crisis. It would involve users taking their own drugs in a hygienic environment under the supervision of trained health professionals. A health centre in the east end of the city would be used for a pilot scheme. The idea has been discussed for years, but it is able to go ahead now after Scotland's senior law officer said users would not be prosecuted for possessing illegal drugs while at the facility. The guidance issued to prosecutors by Lord Advocate Dorothy Bain, KC, earlier this month stated that it would not be in the public interest to bring proceedings in such cases. The consumption room plan will be discussed by Glasgow's Integration Joint Board, which brings together NHS, which is the National Health Service in the UK, and council officials on Wednesday morning. A report on the facility prepared by officials from the NHS and Glasgow City Council says it aims to tackle the problem of approximately 400 to 500 people injecting drugs in public places in Glasgow city centre on a regular basis. I think the case for this is as relevant now as it always was, said Dr. Saket Priyadarshi, Associate Medical Director of Glasgow Alcohol and Drug Recovery Services, which would run the project. Dr. Priyadarshi said evidence from more than 100 similar facilities around the world suggested they lead to a significant reduction in harm, as well as helping users to engage with a range of treatment and care programs. The Glasgow Consumption Room would be based at Hunter Street in the east end of the city, alongside a clinic where 23 long-term drug users are currently prescribed pharmaceutical heroin. Jade, 33, a drug user in the East End, described it as a brilliant idea, which would make a massive, massive difference. She told BBC News that she had used heroin and cocaine to block out trauma from her past and had witnessed many loved ones dying as a result of drug addiction. My ex-partner died of drugs. My dad died. He was an addict. My sister passed away. A lot of my friends have passed away, she said. The consumption room is part of a wider move by the Scottish Government to tackle a crisis which is claiming more lives per head than anywhere else in Europe. Drugs deaths peaked at 1,339 in 2020, before falling slightly in 2021 and then dropping by around a fifth in 2022 to 1,051. Since then, preliminary figures suggest they have begun to creep up again. No single answer. The consumption room plan is supported by Scottish National Party, Labour and Liberal Democrat politicians. But the UK Home Office insists there is no safe way to tackle or to take illegal drugs. That position is shared by AnneMarie Ward, Chief Executive of the charity Faces and Voices of Recovery UK, which helped draft the Right to Recovery Bill tabled at Holyrood last year by the Scottish Conservatives. Miss Ward said the SNP was playing politics by calling for Westminster to amend the 1971 Misuse of Drugs Act to decriminalise possession of drugs, a move rejected by the UK government. Instead, she said, the Scottish government should be focusing not just on harm reduction, but also on treatment, prevention, dissuasion and reintegration of users into society. They are stoking a constitutional debate about independence, unfortunately, and that's at the cost of people's lives, she said. SNP ministers deny that this is the case. Last week, Eleanor Whittam, Minister for Drugs and Alcohol Policy, told the Scottish Parliament the war on drugs is over. No one won, and the main casualties were not organised criminals, but the poorest and most vulnerable. We know that Scotland as a nation needs to do something different, and within the confines of the law, Police Scotland is going to be part of that, working in partnership, said Department Chief Constable Malcolm Graham, head of local policing at Police Scotland. He insisted the force would continue to crack down on drug dealers, but added that supply was only part of the problem. We need to tackle the demand, and we also need to tackle the harm, said Mr. Graham, adding, there is no single answer to this problem that our nation faces. Okay, so when I started this video, I mentioned that the article was controversial. Controversial because it's about drugs, and we know that taking drugs is a bad thing. But allowing drug users to take drugs in a protected environment where they can access treatment, I personally think is a good idea, because people are going to take drugs. And I feel that it's better for them to take drugs in an environment which is there to help them and treat them and try to get them off the drugs and get them back into society. So what are your thoughts in regards to this article? Do you agree with this idea? Disagree? Tell me your reasons why you agree or disagree. Let me hear your opinions in English. And also what it's like in your country. Are taking drugs, is drugs a problem? Illegal drugs, is it a problem in your country? And what is the country doing to try and tackle the problem? Okay, so let's get into some of the words that I really like in this article. The first one is consumption. Consumption. The action of using up a resource, such as drugs. The action of using up a resource. For example, industrialized countries should reduce their energy consumption. Illegal. Illegal. Contrary to or forbidden by law, especially criminal law. For example, illegal drugs. That's the word illegal. Hygienic. Hygienic. Conducive to maintaining health and preventing disease, especially by being clean and sanitary. For example, hygienic conditions are what you find in hospitals. Hygienic. Supervision. Supervision. The action of supervising someone or something. The users of the drugs will be supervised. Someone will be watching them and trying to help them. Another example is he was placed under the supervision of a probation officer. That's the word supervision. Prosecuted. Prosecuted, the past tense of prosecute. And that is to institute or conduct legal proceedings against a person or organisation. For example, they were prosecuted for obstructing the highway. That's the word prosecute. prescribed. Prescribed. The past tense of prescribe. And that is of a medical practitioner to advise and authorize the use of a medicine or treatment for someone, especially in writing. For example, her doctor prescribed sleeping tablets. That's the word prescribed. Addict. Addict. A person who is addicted to a particular substance, typically an illegal drug. For example, a former heroin addict. That's the word addict. And then finally is a beautiful word that I love, and that's dissuasion. Dissuasion. The action or process of trying to persuade someone not to take a particular course of action. For example, no amount of dissuasion from his coach will convince him that he should wait. That is the beautiful word dissuasion.